possibly going to crush the healthcare system. 1 in every 12 individuals in the world right now has either hepatitis B or hepatitis C. And we are we had a program at McCavan that was addressing case management, was doing case management for people with hepatitis C, connecting them to care and connecting them to support services and our own support group. And in about a 3-month period, we put 100 people on our caseload, and then subsequently lost the funding for the program. So I just wanted you to know that this is not anything new, but that we are truly trying to increase public awareness here and hopefully get people interested in addressing this issue in our community. Thank you.
Thank you. Other comments from the board? Okay. Thank you very much. Let's see, we'll move to the next timed item at 11 a.m. This is the annual report to the Board of Supervisors of the 2007 Needle Exchange and other county HIV and hepatitis C prevention programs related to Assembly Bill 547. Please.
To the board, through the chair, my name is Stacy Cryer. I'm the Public Health Branch Director for the Health and Human Services Agency. In your packets, you have the annual report for the Needle Exchange Program for 2007. I'd like to have Charlie Seltzer, who is a Senior Prevention Services Coordinator, come up and summarize the report, and then we'll be available for questions.
Thank you.
Hello, members of the board. I think this is my 5th or 6th time being here over the years. It's nice to see you all again. And thank you for your ongoing support of the Needle Exchange Program. McCavan operates the Needle Exchange Program under a contract for no money from Public Health, and it's a needs-based exchange. Meaning if somebody comes in and says, I'd like 5 syringes, we'll give them 5 syringes. McCavan gets back 98% of the syringes that it distributes to the community. So for example, last year McCavan distributed about 63,000 syringes and got back 62,000 of them. Meaning that the exchange for all practical purposes functions as a 1-for-1 exchange. If you bring one in, you get one back. Last year, I'm actually reporting about 2006-2007 fiscal year. McCavan served an estimated 500 unique, unduplicated clients at the exchange. Now, what's interesting is most of these people exchange just for themselves. They're bringing in their syringes and they'd like some in return. A good sizable handful are also exchanging for other people that we never see. They never show up at the exchange, but these people are exchanging for an average of 10 other people, meaning there's a whole lot of people benefiting from the syringe whom we never see. We estimate that the exchange impacts directly 2,000 people, although only 500 of them show up at the door. For the 500 who actually show up at the door, McCavan makes a large has at its service a large number of referrals, including to mental health, public health, social services, medical care, medical case management, drug and alcohol treatment services as well. Last year, McCavan made about 900 referrals for the 500 people who actually showed up at the door, including 55 referrals to drug and alcohol treatment programs. I want to talk a little bit about numbers of infections of HIV and hepatitis C in our county. The short, depressing answer is we don't really know. We don't know how many people have HIV because not everybody has been tested. We don't know how many people have hepatitis C for the same reason. We know of 122 people with HIV in our county. That doesn't sound like a lot of people, and it's far less than 1% of our county. But the only reason we know about them is because these are people who use public services. If you don't need public services, then we don't know you. We don't know who you are. And there are probably lots of people in Mendocino County with HIV who moved here from San Francisco, from Santa Rosa, where they have great relationships with their doctors, and they don't want to lose that relationship just because they now live in Mendocino County. So they travel to Sonoma County or San Francisco for medical care, and they're not represented in those 122 people. Also, the number is undoubtedly higher because, well, I'll give you the federal estimate. The Centers for Disease Control estimate that there are still a quarter to a third of the people with HIV in this country who don't know it. In other words, our testing programs have not reached them yet. So if that's true in Mendocino County, then there's probably another 40 to 60 people with HIV that we have not even found yet. Some years we don't find anybody with HIV through our testing programs. Last year we found 2, which is great that we found them. Let me tell you a little bit about what we find when we find people with previously undiagnosed HIV. They have a few characteristics in common. They tend to be homeless or mentally ill or have drug and alcohol addictions. And you can imagine most of these will also go together, making these people very difficult. They're not likely to walk into a health facility and say, hey, please test me for HIV. So we have to go out into the streets to find them. And of course, the funding for outreach programs is getting cut year after year after year by the state. So it's becoming increasingly difficult. You know, as some people say, we found the low-hanging fruit already, and now all that's left is the fruit that you have to get the orchard ladders out to find, and it's harder and harder to find them. I want to talk about one more thing. The governor signed 2 years ago Senate Bill 1159, and it allows city or counties to authorize pharmacies in their jurisdictions to sell syringes without a prescription. If the board would like to know more about this, you could direct us. We would research this thoroughly at the agency level and then come back to the board and make a recommendation. So just let us know, and I would like to give you the opportunity to ask any questions.
To the board. Very interesting statistics here. I'm surprised there isn't a number of board members jumping. Well, change the color of your pen. I keep looking over that. Supervisor Delaware.
Thank you, colorblind chairman. Mr. Sells, when you talk about public services, does that include hospitals? Is that a public service? So
Yes.
we have those numbers that are
Yes.
being served, say, at UVMC or Howard or somewhere.
Right. Also people who are signed up for Medi-Cal, who use Community Care's HIV and AIDS program, who use HOPWA, the Housing Opportunities for People with AIDS. All of these are publicly funded programs. So we know who these people are.
So even if somebody uses, say, UVMC and never comes into public health, we still have that statistic.
If they have private health insurance, we would not know who they are.
Okay, so we don't necessarily. Okay.
They would have to be publicly funded in
Okay.
order for us to know them.
Is there, are there any reports that are issued by county or the medical community that says, even so, say it's a clinic in San Francisco, we treat X number of patients that reside in Mendocino County?
No, there are
Nothing
not.
like that exists?
Nothing like that exists that I know of.
Is there a benefit to trying to get something like that too? Or is that, are those numbers really irrelevant to?
You know,
I mean, because you brought up a good point. If we have a lot of folks that moved here from, say, the Bay Area, just for example, and they're still going down there for services because it's easily reachable,